Good day, everyone. Today, we are going to talk about Patricia Benner and her theories. Benner was born as Patricia Sawyer in August 1942 in Hampton, Virginia. Benner, her parents, and her two sisters moved to California when she was a child. Her parents were divorced when she was in high school, which she described as a difficult event for her entire family. Benner decided to become a nurse while working in a hospital admitting department during college. She earned an associate degree in nursing from Pasadena City College, simultaneously with a bachelor's degree from Pasadena College in 1964. She married Richard Benner in 1967, and they had two children. Benner earned a master's degree in nursing from UCSF in 1970 and a PhD from the University of California, Berkeley in 1982. In her early works, Benner published 9 books and many articles, such as From Her Novice to Expert Concepts, The Primary of Caring, Educating Nurses, Clinical Wisdom and Interventions in Acute and Critical Care, Interpretative Criminology, New Nurses Work Entry and Stress and Satisfaction on the Job. These are her honors and awards. Theory overview of Patricia Benner's nursing theory from novice to expert. Patricia Benner acknowledges that her thinking in nursing has been greatly influenced by Virginia Henderson. She realized that the need and importance of addressing the expertise, skill, know-how, and experience rooted in clinical practice to understand and develop knowledge through everyday experiences. Patricia Benner's theory, novice to expert, and the concept of reflective practice was influenced to a large extent by the Dreyfus model of skill acquisition. She adapted their model of skill acquisition to nursing and explains the 5 stages of novice, advanced beginner, competent, proficient, and expert to acquire expertise in nursing. It highlights the differences between practice and theoretical knowledge and is considered a model and philosophy rather than a theory. Here are the 5 levels of nursing experience. We have novice, advanced beginner, competent, proficient, and expert. In novice stage, a novice is a beginner with no experience. They are taught with general rules to help perform tasks, and their rule-governed behavior is limited and inflexible. In other words, they are told what to do and simply follow instruction. The advanced beginner shows acceptable performances and has gained prior experiences in actual nursing situations. This helps the nurse recognize recurring meaningful components so that principles based on their experiences begin to formulate in order to guide actions. In competent stage, a competent nurse generally has 2 or 3 years experience on the job in the same field. For example, 2 or 3 years in intensive care. The experience may also be similar day-to-day situations. These nurses are more aware of long-term goals and they gain perspective from planning their own actions, which helps them achieve greater efficiency and organization. A proficient nurse perceives and understands situation as a whole part. He or she has a more holistic understanding of nursing, which improves decision making. These nurses learn from experiences what to expect in certain situations, as well as how to modify plans as needed. In expert stage, expert nurses no longer rely on principles, rules, or guidelines to connect situations and determine actions. They have a deeper background of experience and an intuitive grasp of clinical situation. Their performances are fluid, flexible, and highly proficient. Benner's writing explained that nursing skills through experiences are a prerequisite for becoming an expert nurse. There are 7 domains of nursing practice. We have helping role, teaching or coaching function, diagnostic client monitoring function, effective management of rapidly changing situations, administering and monitoring therapeutic, interventions and regimens monitoring and ensuring quality of healthcare practices, organizational and work role competencies. In helping role, the helping role domain includes competencies related to establishing a healing relationship, providing comfort measures, and inviting active patient participation and control in care, while timing, readying patients for learning, motivating change, assisting with lifestyle alterations, and negotiating agreements on goals are competencies in the teaching coaching function domain. The diagnostic and patient monitoring function domain refers to competencies in ongoing assessment and anticipation of outcomes. Competencies in the effective management of rapidly changing situation domain include the ability to contingently match demands with resources and to assess and manage care during crisis situations. The domain administering and monitoring therapeutic interventions and regimens incorporates competencies related to preventing complications during drug therapy, wound management, and hospitalization. Monitoring and ensuring the quality of healthcare practices domain includes competencies concerned with maintenance of safety, continuous quality improvement, collaboration and consultation with physicians, self-evaluation, and management of technology. Lastly, the organizational and work role competencies domain refers to competencies in priority setting, team building, coordinating, and providing for continuity of care. The four meta paradigms in nursing, as defined by Patricia Benner. Nursing. Patricia Benner described nursing as a enabling condition of connection and concern. It shows a high level of emotional involvement in the nurse-client relationship. She viewed nursing practice as the care and study of the lived experience of health, illness, disease, and the relationships among these three elements. Person. Benner stated that a self-interpreting being, that is, the person does not come into the world predefined but gets defined in the course of living a life. Benner believed that there are significant aspects that makes up a person. The significant aspects of understanding a person is the role of the situation, the role of the body, the role of personal concerns, and the role of temporality. Health. Patricia Benner focused on the lived experience of being healthy and ill. She defined health as what we can be assessed, while well-being is the human experience of health or wholeness. Well-being and being ill are different ways being in this world. Banner described as health is not absence of disease and illness. A person may have a disease and not experience illness because illness is the human experience of loss or dysfunction, whereas disease is what we can be assessed at the physical level. Environment. Dr. Banner used the term situation rather than environment. It suggests a social environment with social definition and meaning. She used the phenomenological terms of being situated, which are defined as the person's interactions and interpretation of an understanding of the situation.